teddy bear, company for a child at MUSC Sean Jenkins Children's Hospital, who's kept alive by an ECMO machine.
We have seen a very concerning increase in the number of children hospitalized.
As a last resort for patients, Dr. Allison Eckert says those with severe COVID are placed on a life support machine called an ECMO.
You put very large catheters in their neck that take out the blood and oxygenate it within this machine and then put the blood back into the patient's body. And we do this usually when, in the case of COVID, where the lungs no longer work.
Putting children with COVID on the device comes with a lot of risk.
Depending on the patient population and the age, it can have as high as a 50% mortality rate.
MUSC has had a total of 5 children on ECMO related to COVID and 2 additional children with MIS-C who required ECMO.
That is more than really we ever see with other conditions such as influenza. At one point in our PICU, we had 3 children on ECMO.
So far, all children with COVID and MIS-C who have required ECMO have made recoveries.
We still have 1 child in our PICU right now on ECMO. And so, as I said, it is never a guarantee.
But doctors say the life-saving machine is not something to be taken lightly.
Children tend to do a little bit better than adults, and sometimes they're more likely to come off. And so we've been very fortunate.
If you have a child who is eligible for the vaccine and has an underlying condition, those children are eligible for a 3rd dose of the vaccine. In downtown Charleston, Christina Lobo, Count on 2.